The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
Very important, guys, to start slow, go steady. No, it's not a fast race. We're all in this together.
There's a lot of anxiety, depression, and PTSD going on. So just need to make sure that our message as a provider is heard by our minority patients. Making sure that we are here for you.
All right, welcome to Mindful Moments with Pedro Morante. February is often the month of love, but here we would like to expand that definition. Love as care, love as language, and love as something that sustains us when the work is heavy. Today's guests live at the intersection of being frontline care, identity, advocacy, and partnership. Caso, Vega and Vicente Figueroa Feliciano are both emergency nurses and life partners who navigate high acuity care while also advocating for the LGBTQ plus affirming practices within the healthcare. Today we're talking about what it means to show up fully in the ER, to love deeply outside of it, and to keep going when systems are imperfect, but the work still matters. And I would like to introduce two of my good friends. Thank you so much for agreeing to be here, Luis and Vicente in the house. How are you guys doing today?
Good. Thank you for inviting us.
We're good.
This is warming up.
Yes, this is a dream come true and a dream collaboration. Met you guys at DNPs of conference last year with Dr. Daniel and the rest of the DNPs of color. Docs, and thank you for agreeing to be here on this platform. And how are you guys doing today?
So we're doing great. I just came out from my clinicals. He was here at home.
I was just reading a book, so chilling.
So we're doing well.
I'm glad that you share this platform with me. Now, we're going to talk about some important topics here. The first question is the call for emergency nursing. This is very important. What drew each of you to emergency nursing?
In my case, because I became a nurse first, mine was actually a career shift. I all my childhood, I always thought that I was going to end up in healthcare. But at the end of the day, when I came out of high school, I went for engineer school. To make it short, in 2 years, I quit engineer school. I wasn't sure what I was going to do with my life. And at the point I was Vicente already, we spent a year in a relationship already, almost. And he's like, I need you to do something with your life. And that's when I'm started looking again into programs and went into nursing school. And since then, since my clinicals, during my associate degree, I knew I wanted to go to ER. So once I graduated, everything that I applied was ERs only. And since then, that's all I've done. 15 years of emergency nursing. That's my story.
So in my case, I became a nurse after him, but I was inspired by multiple people. the most important one, Luis. But I have a friend when I have a background in business. I have my bachelor in business, then I did my master in business with a concentration in human resources. And the plan for me was to do a to open a like a home care for cancer patients at some point. And I wanted to know what the nurses did and what was asked for them. So I wanted to do something in nursing just to get that knowledge. Uh,
And then he ended up falling in love
then
with the profession.
yes, and finally I went to the ER because somebody told me that I needed to go to the
The
ER.
ER is the best.
And then I fall in love with the ER. I like how you go see the patients, make them feel well, and you see improvement a little bit, and then you change a patient, and you don't have to stay with the same patient every day.
I love how both of you are supporting each other, and how your love story also puts into place in falling in love with nursing and falling in love with each other, right? Now, what keeps you both grounded in such high intensity space?
In my case, what keeps me grounded is actually the patients. For me, patient care and being, as I call it, a fluffer of patients, I I am like I enjoy being with the patients, and I enjoy talking to them, having the interactions, and making sure that they are comfortable and hearing them. That grounds me into emergency nursing. That give me comfort, and I will be the hardest advocate for them, as as I should be, and it's what keeps me staying in the ER.
For me, it's kind of the same. I think when you focus on the patient care, I think everything falls into place, right? Like we are there because we care, and when we are able to provide the care, that's all we need. The issue nowadays is like the healthcare environment is not sometimes providing you that opportunity to do good care because of the shortage of nursing, because of the many boarding patients and stuff like that in the emergency room is kind of challenging nowadays. But at the end of the day, that's what grounds me, being able to help.
Thank you for emphasizing that patient-centered care is really important right now. And I know our profession is facing some challenges, and also our patients too are affected by it. Now, how has your understanding of care evolved over time based from your experience?
I remember coming out of nursing school and being all textbook, right? Because that's all they teach you all the time. You do your clinicals, yeah, but it's not the same. So my biggest evolution at the beginning of my career was like knowing how to take care of the patient, really how to take care of the human being, how to be human, even though it sounds funny. But realistically, you need to learn that first as a nurse. Then I evolved. Then I focus on reading research, trying to be the best nurse out there. So I was just like trying to challenge myself in order to get better at it. And then the last 5 years, we actually ended up doing travel nursing, and we focus in Native American communities. So these are communities that they have tons of health inequities, remote places and all of that. And it actually changed again what we wanted, like how I evolved. I evolved becoming more of an advocate. I got, passionate about that, and that got me started in other areas of nursing, in advocacy and writing and all of that.
So for me, also, my evolution as a nurse was more like a slow evolution, actually. Even though I started in the ER, the same ER, we have been working together since I started nursing. We were working together, same ER basically, with a short period that we were not working together. So for me, I learned a lot by listening and by doing stuff, right? So in nursing and how I grew in nursing, I started slowly and very slowly. But then I move on to learn more and start becoming more active. I started engaging with like professional organizations such as Emergency Nursing Association, the MPs of Colors, um, uh, Association of American Association of Acute Care Nursing. So all of these associations have me when I go to their different conferences and I listen and I go and learn and I go and get that knowledge so I can be a better nurse for my patients.
Thank you for emphasizing your stories on how the development of care over time. And certainly agree with you, right? What the complexity of the patient cases right now are increasing, and at the same time, we really need to address this very important aspect of care, wherein we talk about identity, visibility, and being LGBTQ plus in the ER is also a big topic right now. So, how does LGBTQ plus identity show up or get hidden in emergency nursing spaces like this?
In my experience, LGBTQ patients have been always present, right? The only thing is that it's important to identify and be able to I identify those patients, and it's not identified to be on them, it's identifying to be able to give them the care that they need, right? For me, one thing that we learned while we were doing traveling nursing was that just having a small identifier that you are an ally or that you are part of the community or something that show us like that you respect that community is going to help for them to open up to you and to be able to give you their pronouns, to give you their name, their preferred name, and all that kind of stuff, and give us their identity, their gender identity, all those things are sometimes difficult to understand. And then with that information, us as nurses, we are we have to be advocates for those patients, for them to be respected and treated with respect by using their pronouns, by using their chosen name, by using their gender identity. So that is something that's how I have done it.
And just to piggyback on what Vicente is saying, it's not only LGBTQ. Like, if you, as a nurse, if you maintain that cultural humility mindset, you know that you need to tailor your care depending of the patient that you're treating, just because of their culture, because of the belief and stuff like that. And especially with the LGBTQ population, since we're talking about that specific community, we know the studies. We know what's the data. The data is telling us that they hate to go to the ER, that, they purposely avoid going to the emergency room due to previous bad experiences. We know that the mental health of LGBTQ patients the numbers are not looking good, and the statistics are horrendous. Suicidal statistics are bad. So we need to tailor, like, once I identify this patient is part of the LGBTQ, I automatically try to tailor even more my care. I do care for everybody in a good way, but tailoring a little bit to each patient, I think, makes the big difference.
I agree with you. We based from the statistics that they have previous bad experiences from other providers, wherein they were not given the proper treatment, and that's why they opt not to go to either a clinic, get their primary care done, or even to the hospital, wherein there's so much issues and concerns that we need to address. And now, have there been moments where visibility felt empowering or unsafe in our practice?
Oh yeah, all the time. I have many examples about that. And so for me, in my case, I'm one of these persons that I'm like, I'm gay, I'm proud, loud, and about. So in my job place, I have never, been in the shadows or anything like that. Everybody knows I'm gay. Everybody knows I'm married to Vicente. So I'm loud like that. So in my personal experience, I cannot give you an example, but what I can give you is that an example of my patients, because that's different. When they know that they're visible, like Vicente says, we always have like a pride pin or something, or an ally pin or something, because realistically, and it might sound, something ridiculous, but when they see that you introduce yourself by saying your name and pronouns, that you are kind of savvy in the community, they light up. They're like, oh my God, somebody's gonna take care of me, because there's so many issues that we encounter in healthcare that they come already with a negative mentality. They're predispositioned that they're gonna have a bad experience. And when they see the visibility, they see that we are representing them, they see and once I start talking with them, I always tell them that's my husband over there. So they know I'm part of the community. They know they can relate to me. So I think visibility is everything. It changed the patient completely. I don't know if you think the same.
Yeah, I do agree with you, obviously. But yeah, visibility is important. However, sometimes you can get like, I have become a little bit more louder and prouder. I have been always being shy. He is the outspoken and the shy one. But the issue with when you have visibility is that sometimes some people, some coworkers, or even some patients might try to offend you by calling you names or trying to make you feel down, put you down, or
just
however,
triggering those implicit bias on the staff.
Yeah. However, it's up to us, the members of the community, to accept what we want to accept and allow to give them the power or not. So I take the power away every time that somebody says, "Oh," and use a F word that is not good in our community. I will say, "Oh yeah, thank you for recognizing me. I am very proud of being one," and that's it. And I take the power away. Everybody laughs in the room, and we keep going, and the patient is still yelling at me, but that's okay. I'm here to take care of you still.
And it happens. We've seen everything in the emergency room.
Actually, that was a experience of mine. Mm-hmm. A patient of mine came in. She was an addict, a junkie, and then sorry that I used that word, but she was a substance abuse user, and then she did she started calling me names, and we would have to hold her by a lot of people. When the room was full, she started saying, "Oh, you this," and I was like, "Oh, thank you," and everybody in the room started laughing at it, and they were like, "Wow, how you come with that answer?" Is that she cannot have the power. I need to take that away from her, and that's it.
Thank you for sharing your lived experiences, and at the same time, those are insights wherein we are more aware of what's going on the bedside, and also some patient experience that you guys have shared. And those are valuable tools for us, to eye-opener for us at the same time. You guys are awesome for turning that into chaos into something that is light. All right. Now, advocacy in action, LGBTQ plus affirming care in the ED. Now, Luis, your work focuses on enhancing LGBTQ plus affirming care competency. What gaps do you see most often in emergency settings?
So the list is huge, but let's start with what the literature says, right? There's a huge gap in how we train nurses and how we train providers in taking care of the patient, okay? So there's a lot of curriculum changes that we need to do to these nursing programs and providers, whether it's a doctor or a nurse practitioner. We need to tailor a little bit more to be more at least having them with that cultural humility mindset, at least. So that's one gap. The other gap is already the perception that the patient have of the healthcare. They already know the system is kind of broken, and they come in a negative way. They came because they don't know how to treat themselves. Otherwise, they wouldn't come to seek care. They didn't have any option. But the other limitation is there's been a lot of studies and like projects that have been documented in literature to increase the competency, and most of them relate to training, but yet there is a lack of, or a gap in the methodology itself. So you will see 5 projects, but 5 projects did it differently. They use different methods, different tools, and yet they don't outline it specifically. Like for me, if I find a good project with good outcomes, I'm not going to be able to replicate the same project. And that's one of the biggest challenges when you are trying to look for these interventions and implement it on your side. It is just a gap in the methodology of some of these projects and studies. But yeah, many limitations.
And I think we really need to look at the nursing curriculum and how it aligns with the care, because most of this are missing the competency, or I think something that we could do better in order to cater for our patients' needs. And I agree with you. Now, Vicente, from your bedside perspective, what small actions actually make a big difference for your patients?
Let me start by saying, piggyback on what Luis was saying, that there is a huge gap on that issue with the LGBTQ affirming care. But at least in my and I will talk about my program. I'm doing my PMH MP, and in my program, they are trying to include a little bit more of inclusion, diversity, and they are trying to teach us that way. But still, is something that needs more work on. On my bedside, what makes my my patients a little bit feeling better is just listen to them. Take the time. Just what even though you should be in, and this is what sometimes they're expecting of you. You need to see the patients 10 minutes, and then 10 minutes, and then these days. You can do that, but at the same time, you can chit chat with the patient. You can talk to the patient and make sure that they are comfortable. Ask what they are feeling. Ask them. Listen to them. When you listen to your patient, the answer of what they need is right there. Sometimes you listen and you will get all the information that you need, and you will be able to treat them properly, take them fast, and you listen to them. They are happy.
At the end of the day, when you look at the qualitative data in literature, with the interviews of LGBTQ patients, they just want to be treated. They just want to be taken care of. They encounter many issues. For example, transgender patient. Usually, there's even a term for that syndrome where the doctor will focus whatever they came in for and try to, link it to the transition or something like that. It's not always related to their transition or their hormones, or, look at the patient, evaluate the patient. They just want to be treated as patients, not as an alien.
I agree with you. Being seen, being heard, and being validated are very important. This is very powerful conversation. I'm liking it.
And nowadays, with the political environment that they're killing all these DEI initiatives, right now we have some legislation in Florida. They are not requiring, well, it hasn't passed completely, but basically they're removing the requirements of employers to use your pronouns or to have more than one sex in the more than 2 genders in the forms. They're removing all of that. So we are in a very difficult time in the country. So that doesn't make it any better.
And that can put a lot of mental health barriers and can worsen symptoms patient. And representation is very important.
And that representation is important no matter what, in no matter what aspect. Me as a Puerto Rican, being here as a Afro-Caribbean person, as a indigenous Caribbean person, as a Spaniard or a European Caribbean person, that is making me there, putting me out there, uh, showcasing a difference. Sometimes we don't see. I studied back in Puerto Rico, so all my professors were Puerto Rican, so I didn't have this. But here in the States, what I have seen is that most of the professors are mainly white. So how we can engage with these professors if they don't have the same lived experience, if they don't look like me, if they don't understand me, because sometimes my accent is in the way and they don't understand what I'm saying. That those type of things are important. Visibility and being present at the table, in every table, is important.
I could not further agree with you. As people of college here, I came from Philippines and as immigrant, it's very important also to have that sense of belonging, right? Now,
Absolutely.
wanna piggyback on your point of view. What misconceptions still exist about LGBTQ plus patients?
Uh-huh.
So the first one is that if you have HIV, you are going to transmit that if you poke somebody and you poke yourself or whatever. Most of the time, people with HIV at this time are being treated, are non-detectable, and they are, if you're undetectable, you're untransmissible. So that's something that is a misconception, one of the big ones. I think that is the main one. Actually, I think that is or that as soon as they know that you're LGBTQ, or at least the G part of the LGBTQ, they are going to verify that if you do you have HIV? Do you think this? And they will think that it is what it is.
It is one of them. HIV is one big one. And right now, people, if you look at the numbers, the gay community is not the one with the highest number. The highest numbers come from drug users, females or heterosexuals. It's not even the LGBTQ community, but we still get stigmatized because what happened in the 80s and 90s, right? So that's one of the big misconceptions. One of the other ones is the one that I mentioned about the transgender, that they ended up being treated. They come from abdominal pain and they already gonna try to make it relatable to your transition issues with your hormones and something like that, and they're missing completely that it's a gallbladder. And that happens a lot, and it's been documented in the literature. But there's so many other misconceptions.
So you can also add the intersex part of it. If you talk about the intersex patients, they're realistically, I have not seen a proficient physician or and I'm sorry, or provider that can treat this type of patient accurately, because they don't know, they don't understand it still. And it's as simple as they have characteristics of both sexes, and they are going to have a specific need. So it's treating that need. And those are misconceptions, and they are like they are difficult, because sometimes these intersex patients, the family shows for them what type of gender they were going to be, and afterwards they were not aligned with the same gender that the family choose for them, and it's difficult to help them.
At the end of the day, Pedro, like, the sad part here is that we're talking about healthcare providers.
Yeah.
We're talking about nurses, doctors having this misconception about the communities. It's not like we're working in McDonald's and we have no LGBTQ training. No. We are talking about nurses and doctors, and they still have these misconceptions about the community. So this is sad.
And I think it's an eye opener too, that we have to keep them informed and making sure that we do this training making sure that they do it also in orientation phase, right? And public awareness and also healthcare provider competency training programs should be instituted or provided to. I think we can do better on our healthcare system, and we can take an initiative and advocate for this. Now, I want to talk about the team love in high acuity spaces. I'm very curious about your love story. How did your love story begin?
I will start with that.
I'm like, you Irving, which version?
I will start with that one, and I will jump to when we start dating. So yeah, so when we start dating, I was already working with in my previous life, and yeah,
In business.
previous life, and that I don't like anymore. But yeah, I was working in business. I was working with in a different setting, and I pushed Luis to go to school because I not a misconception, but I told him I'm not going to take care of you forever if you don't work. I need a partner. I don't need somebody that is not a partner. So I pushed Luis to study. After he graduated, he started working. I got more encouraged to study nursing. Seeing him, having seen a friend of mine, and having a lot of friends from the nursing department when I was studying in Mayagüez, University of Puerto Rico of Mayagüez. So those things get me inspired. So I start working, and then finally, when we have been working, but it has been easy to work with because at some point we were not working in the same. We were working in the same emergency department in different areas, and then we when we get home we would talk about what we did because we were so busy that we didn't see each other in the shift. That's one part of it.
Bringing the story back to the love story, though, I met him through a friend who invited me to a party, and this friend's boyfriend was his friend. So he got invited to the same party. Mind you, years before we actually studied in the same university when I was in my engineer program, and we have seen each other, but we never made a friendship or anything like that. Now, years later, I'm telling you, like 40 years later, we meet in this party, and everything got started from there.
And everything turns into magic, right?
Well, yeah, you can say that. And 16 years later, we're here.
Wow.
Working together is easy because it's sometimes like looking at each other, and you know that I need help and I need you right here, right now, because this patient is not good, or we are just so like used to help each other, and we work as a team. And even not with Luis, I work as a team always, but especially with him, I work as a team.
Thank you for sharing that. Now, what's unique about being partners who both work in emergency care, and what are the pros and cons of being in the same line of work as partners?
Months that we are 24/7 together. So at some point, like for the last 5 years when we were doing traveling, we will ask for the same contract, same days, same ER. So we will have the same days together at work, same days off. So finding that space to breathe and have your own time, well, you need to get creative. And the biggest pro, though, is like in the ER specifically, we can have a code, and I'll be needing something, and I just need to look at Vicente, and Vicente already knows what I need, and and he reacts. So we do make a huge team when we work together in our emergency room, and I think that's, for me, that's the biggest pro.
My biggest pro is the teamwork, and that's an easy one. That's the most easy thing that to say, right? And it's the real thing. But the hardest thing is if, let's say, we both did charge at the same unit on the same days, well, on different days, but in the same unit. Sometimes I was the charge, sometimes he was the charge, and sometimes having that position that you have to be not above, but that you have a little bit more responsibility at that time, can make you sour sometimes, right? And you get a tiny fight here and there, but that's okay. Mainly not that we are going to take that to the workplace, but it's something that you carry with you, right? You are in a relationship. Sometimes you don't want to see the person because you're mad, and that's it. And it's part of the relationship. But the important thing is to not try to take that with you to work.
Another thing, I think a lot of couples can relate to this, even if they don't work together. We are each other's biggest critic. So we're both nurses. We both know the work. We're both certified. We are both proficient. So we don't have a healthy competition per se. We just make sure that he's working at his max and I'm working at my highest. It's like, again, the biggest critic 24/7, including at work.
Another perk is, like, for example, not that I don't like acute patients, but I do my best, and I will take it. I will make them stay alive. But this one loves acute patients. So as soon as I have one, I say, "Do you want it?" And he will say, "Oh yeah, give me that patient. I want to get on top of it."
And he take the peds.
And then I take the peds, and I make them take the medication and everything. If there is a Foley, then he will say, "Oh, go and put that Foley for me because that is my favorite intervention as a nurse."
If it's an NG tube, it's mine.
And then it's an NG tube. So we that's some perks that comes with.
We complement each other.
That's all about partnership, right? Having to at least make your life easier and at the same time enjoy each other's company, and that's a very good one. Now, how do you protect your relationship from burnout, compassion fatigue, or work stress?
Yeah. So when we get home, we try, and I'm gonna say try many times to leave work behind, because realistically, that doesn't happen 100% of the time. But we try to limit that, especially if we are going out with friends and stuff like that they're nurses too. Okay, we're gonna talk about work the first 10 minutes. After that, nobody can talk about work, because you need to find, nursing is so heavy, emotionally heavy on you, that you need to be able to find ways to disconnect. Because if not, you're gonna go home, you're gonna keep thinking of that critical care patient, and you're gonna go to bed and you're gonna dream that you're giving compressions. And I have seen that, I have lived that. I'm talking about experience. So it's very important for me finding a way to disconnect.
Even though we don't like to talk about work when we are at home, if we have like a tiny section of the day right after work that we are going to complain of everything that we want to complain of to each other. Even it's not necessarily between us the thing, but we will complain and we say this happened and this is what happened and this is what happened, whatever. And then that helps, at least helped me to leave that there and put that away from my imagination or from my thinking, and it helps me wind down a little bit. Also, I enjoy Disney, I enjoy Universal, so anytime that I want to disconnect, I will try to go to one of those places, just because it will make me disconnect completely. It will make me not think on nursing. I just want to go on the rides. I want to see, spend time with Luis, hold hands with Luis, be romantic with Luis, and be present and be there. So,
yeah. And I think that's a big part. A lot of friends, like nurses, would say, "Oh my God, at least you go home and you can talk with somebody, and that somebody will understand what you're talking about the difficulties and the challenges of work. Is some people would tell me my husband doesn't understand what I'm talking about at all. So it's kind of difficult to have that venting session and, being able to decompress.
So recommendation for anybody that is not a nurse, just say yes and use all the adjectives that you want to say about a different person. Just agree with your wife or with your husband. And that happened to me when he was working and I was not. I went and picked him up at work back in Puerto Rico, and he was all the way complaining, and I was quiet, and I was like, oh yeah, okay, yeah, do you want something to eat? And I brought him food so he can, and then everything passes. So
I think that's the key, right? Or just lend an ear and make sure you address the needs and let them do the talking most of the time. Yeah. And it ease out the burnout feeling. Now, how do you recognize burnout in yourselves or with each other?
I think that's part of when we talk about emotional intelligence, we focus a lot on the other person, that we need to be empathic, that we need to be active listeners and stuff like that. We forget about the part that says that you need to be self-aware and, being able to stop and say, okay, how am I doing emotionally right now? Because that's going to affect my interaction with Vicente, my interaction with my patients, my interaction with everybody, realistically. So, and sometimes, given we have many times told to each other, okay, you need a vacation. You are getting to that point that you're getting cranky, that you can see the mood shifting, and being that not only is self-aware, but aware of the other one, and being able to say, Vicente, take a day off, and Vicente will take a mental health day off, no problem.
Thank you for seeing my answer.
Okay. You can talk now. You're good.
So yeah, definitely when I start getting like that overwhelmed, and it's not overwhelmed with the work that I do, it's overwhelmed with all the emotions that are around me, all the stress that is around me. First of all, I need to take I do take my mental days, and I call out, and I just calling out, and I will take my day to watch Netflix, to be at my bed, to sleep, to do whatever, to be mindful of myself. Because if I'm not mindful, and I don't have that moment to be mindful, I cannot be able to see what is happening and to take that emotion away and to deal with that stress. So I need those type of, I do enjoy those type of days at some point, sometimes, not now, but sometimes.
Thank you for sharing that. And what does love, romantic, communal, or self-love teach you about the kind of nurses and people you want to be?
I think like how did Bad Bunny put it just today? He said the biggest thing, something bigger than hate, is what? Love. And I think love defines a lot of things in as a person, as a professional. Like, I think self-care, self-love is very important. It's like Vicente say, like if you're not able, to be in agreement with yourself, how can you be able to perform, right? And I think that is the same way. If you don't love yourself, how can you provide love to somebody else? So that's
RuPaul.
Yeah, RuPaul would say something like that. So it is very important, and keeping love at the center. Nursing is love. We're caring all the time. This is about love, period. However you see it, that's what it is. So in my opinion, it has to start with you, though, as with the individual, being able for being able then to portray that love to your partner, to your patients, to your community, etc.
So just thinking about what Luis said, nursing is a love profession because we don't get paid as other professions, the ones that are above us, and they don't spend the time that we spend time with the patients, and we are paid way less than the provider, right? So we do it because we have the love for that, because we are empathic, because we are mindful of what you want to do with others and how you want the society to be, right? At least that is my way of seeing things, right? But how you take care of yourself, and make, well, first start by taking care of yourself, make sure that you're in a good place, and then you can share all that love that you have inside with others, like your coworkers, your providers, your patients, anybody that you interact with at that time, right? We have patients, but realistically we have also others, people that depend on us, and they will share with you some stuff, and they will need help, and they will need some guidance at some point, and they will come to you, and then you can share with them and tell them how you feel and about their issues.
And just to piggyback a little bit on what you were saying, I think that's the beauty of nursing, right? We tend to see the person as a whole, with many elements, other than seeing a person, trying to pathologize everything, this is a diagnosis, this is the treatment, and go. Because sometimes I feel medicine works like that more, while nursing is taking care of the whole. Sometimes I see as a nurse that what we call the therapeutic touch and a good conversation with the patient can actually help them more than any other nursing intervention that I would do with them in the whole shift.
Yeah.
So
Yes, I agree with both of you. And being in the hospital alone is very stressful, right? So you want them to feel safe
absolutely
at all times.
Yeah. If they feel safe, they are going to give you the information. If they feel safe, they are going to be happy. If they feel safe,
they're gonna be more engaged with their care. We are discharging them, but we are giving them instruction. If they feel like they were in a safe place, that they were confident talking with you, they're gonna do what you are telling them to do at home.
That's why we are the most trusted profession.
Thank you for emphasizing that. And now you guys are a power couple for me. And for those couples who are on the same line of work, what will be your best advice in order to nurture the relationship and keep it strong? Especially you guys are going 16 years?
16 years, yeah.
Oh, wow. Okay, that's
so,
met.
So for me, and something that works for me, and I'm not encouraging anybody to do this. This help me only, okay? I look for a fight every day with Luis. I like to get him mad, and I like to see him mad, or I want to fight with him. At least I schedule like a 30 minutes fight with Luis. In my mind, I have to fight for any tiny thing, and I have to complain about it, and I will complain,
and that make me happy or something,
and then I will make him happy afterwards. And then also at the beginning of our relationship, I always make him get mad because I wanted to see him mad, and then I would laugh at him, and I would tell him that he was playing, so that helped me at least.
So for me, is get rid of your PTO. If you have PTO, you need to go on vacation. Go take your vacation, and not everything can be job and relationship. You need to de-stress somehow. We are one of those people that if we can take 3 vacations in a year, we will take 3 vacations in a year. And in each vacation, we will have at least a day of spa. Because realistically, that interaction when you're outside the regular environment, outside the job in another country, I think that helps you a lot. to connect with each other. Like, I think the most thoughtful, important conversations that we have had as a couple is always during a vacation. In the middle of, I don't know, nowhere, in a cruise or in Spain or something. So I think that at least helped me, keep it together.
Go to Spain. That is an amazing place.
Oh, I've never been to Spain, so I think that's one of my bucket lists.
Oh, just let me know. I will do your itinerary.
Thank you. Now let's do the rapid fire. This is I'm gonna ask you a question, and then you guys will answer. First thing you do when you come home after a hard shift?
Go to sleep.
Oh, I need to shower.
Shower. Okay, great.
I'm one of those that I need to leave it in the bathroom, with the shower and the water running.
Yeah.
Who falls asleep first after night shift?
Me.
It's like, have you seen The Simpsons? Homer, that he will say, okay, I'm gonna go to bed automatically. He's kind of like that.
It can happen, not every day, but it can happen.
Like this, super fast.
Debrief together or quiet cuddle first?
They brief always.
Debrief.
Always. We do it's like a 5-minute, I don't want to call it complaining session. Let's put it that way. And then after that, we can cuddle and sleep and be cool.
Yeah.
Now, coffee, comfort food, or takeout after a rough day?
I think takeout or comfort food.
For me, comfort all the way.
But takeout can be comfort.
Yes,
so
that's true.
It's the combination of those two, because if it's a stressful day and I am tired, I will not be cooking.
Surprisingly, we are Puerto Ricans, but we are not big coffee drinkers at all.
No.
Wow, okay. I think they have great coffee beans, right? In Puerto Rico.
Yeah, they do. And it's good. I'm not saying that we don't drink coffee. Is that we don't drink coffee often.
Okay. Wow, okay. It's very rare, right? A lot of nurses are pre-caffeinating before they start.
Oh, yeah.
Especially Puerto Rican or Latin nurses.
I'm the night shift.
They are going to be like, oh, you are not having that Latin card anymore.
Now, who's more likely to say, I got you during your burnout moments?
Nah.
I will call that he has burnout.
He will call it though, but I'm not a supporter.
Oh.
I'm like, listen, the side part, the behavioral health, that's him.
Yeah,
it's like when we get a pediatric code, I go save the kid. Vicente will stay talking to the mother.
But that's what I'm saying. I will call that you are on a
right, but he's talking about support. Who's the support?
And I will support you. I will send you away and I take care of your patient.
Thank you. Now, who's more likely to say I love you in the relationship?
Me.
That's your love language. Love affirmation. So who said I love you first in the relationship?
I think I did.
You did.
Absolutely not.
I don't know.
I don't remember, but probably me for sure.
I really don't know. But
Vicente's not a big romantic.
No, I'm. If something, I will consider not that I'm totally a romantic, but very down there in that spectrum.
Now, one relationship habit that made you a better nurse.
I'm a learner by listening, right? So every time that he discusses something with me about the situation, or he reads a journal or something, a research or whatever, and he shares it with me, like he talks to me about it, I will keep that information and I will grow from it. While he will forget about what he read, I will recall it and I will be saying, yeah, you taught me that.
And I think, like I mentioned, we are each other critic. And because of that, we push each other to be better every day. So it's kind of good having that support, hate and love relationship support, but it's there nonetheless. It's still supporting, even though it's kind of rough sometimes.
I would not call it hate, dislike. Dislike
it's
and
just
love relationship.
Tough love is what I say.
I love it. Now finish this sentence. love in the ER means?
Caring. Love
I-
in the ER means
I have to say caring too, because that's
caring, being present for the patient.
make sure that the patient is happy, content, and trusting you.
Avoid being a robot, asking the triage questions. Oh, do you smoke? Do you this? Be a human being with them. That's love.
Thank you. And last Super Bowl weekend, last Sunday, we saw Bad Bunny.
Yes.
What was your take on that one, on his performance as Puerto Rican?
Well, in my personal opinion, I thought Shakira's and J-Lo's halftime show was more amazing than his, but the way he showcased Puerto Rican culture in that show was above. I cannot even tell you, like, I could relate so much seeing, I don't know, the boxers and stuff like that. Boxing, Miss Universe, those things are huge in our community in Puerto Rico. And then, seeing all those elements, because I'm pretty sure a lot of people didn't understood some of the elements, per se, when he was standing in the middle of the electric poles and stuff. You don't understand because you don't live in Puerto Rico. So you don't know that our power grid in Puerto Rico is useless right now. So if you're not Puerto Rican, you probably don't understand that part. Yeah. But I think the way he showcased Puerto Rico as a community and then America as a whole with all the countries, I think that's very impactful, especially in the political environment that we are right now.
So I was working, so I didn't watch it completely. I have to still watch it in YouTube. My bad. However, whatever I watched, it was amazing. I do, and I love Bad Bunny. And then my take on it is that it showcased Puerto Rican culture. It was a very political message, having the kid that was deported by ICE, having the electrical grid that is falling out.
Having two guys dancing together.
Having two guys dancing together. But also he called out for all Americans and all the Puerto Rican people, because Puerto Ricans, we have 3 millions in the island and we have 5 millions in the States, because we have a great migration at some point. So he did call to those people that went to New York and all that kind of stuff, like doing some particular things that showcase that interaction of that community of the Puerto Rican people.
Hey, don't forget the wedding. The wedding was real.
No.
By the way, I read today that the male is a nurse.
Wow, okay.
Yeah, in halftime show.
It's amazing, right? I love every bit of it too. It's like thinking outside the box too, right? Thank you for that. I think 1 hour went by so fast. And
I know, right?
As we wrap up today's episode for Mindful Moments, we're reminded that love doesn't always arrive with flowers or chocolates. Sometimes love looks like understanding the weight of a long shift. Sometimes it's choosing the patience, laughter, and the grace again and again. Luis and Vicente, thank you for showing us that love can live in the middle of emergency rooms, advocacy work, and everyday life, and still feel safe, affirming, and beautiful. This Valentine's Day season, we're celebrating all forms of love. The love we share with our partners, the love we give our communities, and the love we owe ourselves as caregivers. To all our viewers, happy Valentine's Day. May you feel seen, supported, and reminded that the care you give matters. This has been Pedro Morante from Mindful Moments. Until next time, lead with love, breathe deeply, and take care of each other. Thank you.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.